Good day everyone! I'm Precious Grace F. Gabon, a student nurse from JSU Real Estate College, Pagadian. And today I'm going to perform the nose and sinuses assessment. Also, I'm going to perform hand hygiene to protect my patient and myself from infection and cross-contamination. Good day, ma'am. I'm your student nurse, Precious Grace Gabon. How are you for today, ma'am?
I'm fine.
Okay, may I have your name and birthday, ma'am?
My name is Jessa Arquiao, January 10, 1998.
Okay, Miss Jessa, so today I will be doing a nose and sinuses assessment. So I'm going to check your nose to determine if there's any abnormalities or any diseases. So during the conduct of assessment, I might be touching your nose or any parts of your face. And you're gonna tilt your head backward looking at the ceiling while I'm checking your nose. And all of the result will be documented, but it will be kept confidential and private. Is that okay with you, ma'am?
Yes.
Do you have any questions or clarifications, ma'am?
No.
Okay, would you mind if I close the door so that no one from outside will be able to distract you while we're doing the assessment? Okay, Miss Jessa, mind if I ask, do you have any history of allergies?
None.
Difficulty breathing through the nose?
None.
Sinuses infections?
None.
Injuries to nose or face?
None.
Nosebleeds?
None.
Medication taken?
None.
Or any changes in sense of smell?
None.
Okay. So, okay, are you comfortable with your seat, ma'am?
Yes.
Is the temperature alright?
Yes.
So, now I'm going to inspect the external nose for any deviation in shape, size, or color and flaring or discharge from the nares. Okay, so the color of the nose is the same as the rest of the face. There is no discharge in flaring from the nares and the nose is in midline. So now I'm going to palpate the external nose to determine any areas of tenderness, masses, and displacement of bone and cartilage. Does it hurt, ma'am?
No.
Okay, so while palpating the nose, there is no masses. The nasal structure is smooth and symmetric, and the client nose reports no tenderness. So now I'm going to determine patency of both and nasal cavities. So Miss Jessa, can you close your mouth? Breathe. Breathe. Okay, so the client is able to sniff or breathe through each nostril while other is occluded. So now I'm going to inspect the nasal cavities using pen light. Just tilt your head backward, ma'am. Okay, so the nasal mucosa is dark, moist, and free of exudate. The nasal septum is intact and free of ulcers of perforations. The turbonates are dark pink, moist, and free of lesions. There's no presence of redness, swelling, growth, and discharge. So now I'm going to inspect nasal septum between the nasal chambers. Okay, so the nasal septum is in midline. So now I'm going to palpate sinuses. Okay, so the frontal and maxillary sinuses are non-tender to palpation and no crepitus is evident. And now I'm going to percuss sinuses. Okay, so the sinuses are not tender on percussions. Okay, we're done in our assessment, Miss Gisa. Thank you for participating in this assessment. And I'm going to document all of your findings in the patient's chart and refer to the doctor or nurse on duty if there is abnormalities that needs immediate treatment. Okay? Okay, God bless.